So this all suggests that Parkinson's disease is preventable. And why do I say that? There's only one well-conducted study that I know of that's shown that the incidence, the number of new cases of Parkinson's disease is decreasing, and that was done in the Netherlands, which found a 60% decrease in the rates of Parkinson's disease between 1990 and 2000. And I looked back and I looked at these 3 environmental risk factors and found substantial reductions in air pollution, pesticides, and trichloroethylene. Now, these are just associations. I'm not sure if they caused it, but it's worth noting that between 1990 and 2012, levels of air pollutants in the Netherlands decreased by 50% or more. The levels of pesticides that are known to be linked to Parkinson's disease that dissolve in fat in your brain, as many of you know, is covered with fatty substance, drop between levels of 75 and 90% decreases in pesticide levels in people's fat. And trichloroethylene in the Netherlands had about the lowest level of trichloroethylene in its air of any country in Western Europe in 1981. And Western Europe many nations in Western Europe have since banned TCE. And if you look, that's in the Netherlands. So what's going on in the United States? This is a map created by my colleague, Dr. Allison Willis, and her fellow investigators looking at the incidence or number of new cases of Parkinson's disease in the United States. And you can see that it's not uniform, that there are certain areas of the country, the Midwest, Southern Texas, California, that have higher rates of Parkinson's disease than others. And if you look at the maps of air pollution in the United States and Parkinson's disease, you could perhaps see a correlation, at least I do. I'll let you be your own judge. And if you look at the maps of paraquat use in the United States and the maps of Parkinson's disease, you might see a match as well. And if you look at the maps of releases of chlorinated chemicals like trichloroethylene, TCE, between the release of those chemicals and the map of Parkinson's disease, you might also see a relationship. So this all suggests to me that Parkinson's disease, much of Parkinson's disease is likely man-made. That's due to environmental factors that are common in our environment and are increasingly found globally, includes specifically outdoor air pollution, certain pesticides, especially paraquat, and dry cleaning chemicals like trichloroethylene and perchloroethylene. This all suggests that we can actually, prevent and end Parkinson's disease. And if we know what the causes are, we can more efficiently identify effective treatments for it and limit our exposure so that if you have Parkinson's disease, you can, ensure that you're breathing clean air. You can ensure that you're buying organic, that you're washing all your fruits and vegetables with water and a pesticide wash, that you're putting a carbon filter on your water to decrease your exposure to any chemicals that are in it. That if you're one of the up to 40 million Americans who get their water from a private well as opposed to city water, that you have your well tested, and you have your well tested for pesticides and these dry cleaning chemicals. So what can you do to help us prevent and end Parkinson's disease, to create a world where Parkinson's is increasingly rare, not increasingly common? You can, join the PD Avengers. So you can do that right now. Go to pdavengers.com. I'll pause and let you give you a moment to do that. After you join PD Avengers, which is a global grassroots organization created by and run by individuals with Parkinson's disease, you can sign up for our newsletter to learn about additional ways to prevent, care, and treat Parkinson's disease. Both of these are free. You can just go to our website, endingpd.org, and sign up for our newsletter. It'll take you less than 30 seconds to do so. You can tell your representatives to ban paraquat, trichloroethylene, and perchloroethylene. The EPA identified in December and in January that PCE and TCE pose an unreasonable risk to human health. The Environmental Protection Agency concluded that perchloroethylene and trichloroethylene pose an unreasonable risk to human health. If these chemicals pose an unreasonable risk to human health, they should be banned, and sites that are contaminated should be cleaned up, and people who live near these sites should be notified, and people who have their homes, schools, and workplaces contaminated should have remediation systems put in place. You should also tell your representative to endorse the National Plan to End Parkinson's Act, helped created by the Michael J. Fox Foundation, was first introduced into Congress last year and been reintroduced this year. It's time to pass this act so we have a federal plan to prevent and end this disabling disease. Next, you should read our book, Ending Parkinson's Disease. It's available on Amazon or at your favorite bookseller. All the authors are donating all of our proceeds to efforts to prevent and end Parkinson's disease. If for any reason you can't afford a copy, just email us at info@endingpd.org, info@endingpd.org, and we'll send you a complimentary copy. Just let us know your mailing address. Next, we need to hold wrongdoers accountable. We saw what the makers of paraquat have been doing in concealing their risks, at least as reported by the journal The Guardian. If wrongdoers are able to get away with their actions, they're only emboldened and will do even more dangerous things. We need to hold wrongdoers accountable, whether they're producing pesticides or other chemicals that are causing Parkinson's disease, cancer, or other diseases. And finally, we love to hear your stories. We love to learn from you and your experiences with these chemicals or with Parkinson's disease. You can just email us anytime at info@endingpd.org. And so some people say I am a little bit of a downer, but I'm going to end on a high note. In 1938, Americans were paralyzed by polio, and which was causing their children to become disabled and paralyzed, closing down churches, schools, and swimming pools. In that setting, a group of ordinary Americans started a March of Dimes, in which they mailed in dimes to the White House to President Franklin Delano Roosevelt and raised millions of dollars. 17 years later, from 1938 to 1955, Jonas Salk developed a vaccine to prevent polio, and we now live in a world that's largely free of polio. In 1980, a young girl was killed by a drunk driver who had, I think, 4 previous convictions for drinking and driving, and her mother had enough, and she formed an organization called Mothers Against Drunk Driving, MAD. 8 years after the formation of that organization, drunk driving was found to be illegal throughout the United States. The drinking age was raised, and the levels of alcohol in the blood that were permitted were lowered. And today, thousands of us have not suffered from car accidents from drunk drivers. And the beauty of it is none of us knows which of us has been saved by the actions of some courageous mothers. In that same decade, later in the 1980s, a group of activists adopted a slogan of silence equals death, because an unknown virus was killing men in San Francisco and in New York City. Led by Larry Kramer, this motto of silence equals death changed the course of HIV. Today, HIV is preventable and treatable. In fact, more people receive appropriate treatment for HIV today than they do for Parkinson's disease. These are all gifts that we've inherited from previous generations: a world largely free of polio, a world where drinking and driving is socially unacceptable, and a world where HIV is preventable and treatable. These are gifts that we have received. It is time for us to reciprocate and to create a world where Parkinson's disease and many cancers are increasingly rare, not common, and to allow future generations to live largely free of this disabling and deadly disease.